Okay, so I'm going to ask you a few different questions from not my list. Right?
Sure.
Nowadays, what I'm noticing, there is a trend in which is going in a different direction, like old osteopathy books or whatever books we was earlier I was reading. There's a two similar term they're using in a different way. One is like osteopathic lesion and somatic dysfunction. Both the same thing.
They are not the same thing.
Their inner meaning is different.
They're not at all in the same neighborhood.
But people got confused. So could you please elaborate about this? This is a big thing which I wanted to ask for a long time.
Here it comes. Ready?
Yep.
AT still said he was treating the osteopathic lesion.
Yep.
What is that? He said that is your overall encompassing problem. It was physical, it was emotional, and he said spiritual. Spiritual mean different things to different people, which is not a conflict. Different religious views or people that don't have any religious view. It's something that's really affecting your life. Key lesion. Yes, maybe your neck's hurting you and maybe whatever technique you did for the neck, but he was looking at changing something fundamental that is blocking your life. Now, osteopathy was manipulation only in the US, where it started. And then World War II came. World War II, like every other war, they always suddenly need more doctors. So the US government came to the osteopaths. They said, you're so close to the MD. If you would just study pharmacology and surgery, we'll give you the same license. And that happened. That was a fundamental change. Good and bad. Good because I have 11 years of education. I delivered babies, done surgery, I understand medicine, and my license is general medicine. And that is as an osteopath in America. Osteopathy outside the United States, it's non-surgical, it's non-pharmacological. I think that may have changed in Britain during COVID. They may have extended them the rights to do antibiotics and some other medicines. I'm not completely sure about that history. But generally speaking, non-medical, non-prescriptive, non-surgery. So my education is vast. The bad side is that most of the people I went to school with don't do osteopathy at all. If anything, they'll do the sloppiest neck crack or back crack or something like that. Something that is what they're able to do. And they're doing obstetrics, surgery, medicine, whatever. Same as the MD. My license is equal and the same. Took my medical exams. I'm sitting here, MD sitting next to me. They hand me the same exam. Then I take an extra osteopathic exam for manipulation. But our medicine is the same. Now, the word somatic dysfunction, well, when we became amalgamated more or less under the same licensing procedures, the MD said, we are not going to call anything an osteopathic lesion. We're MDs, we're not going to use that word. What is a politically palatable word? Somatic dysfunction. That's why that changed. What is a somatic dysfunction? My shoulder hurts. It's a somatic problem. My shoulder hurts. Maybe my shoulder hurts because I'm having early liver problems or other fascial problems or other emotional problems. I could have a car accident and hurt my shoulder. I can have a car accident and my mother's funeral was the day before and hurt my shoulder. And they're two different injuries. To reduce everything to say it's somatic is a dilution of osteopathy. It's not osteopathy. So he still said he was treating the osteopathic lesion. In my terminology, I'm going to say I'm treating the key lesion. And I'm going to treat what your chief complaint is. You see my shoulder hurts? I promise you I'm doing things to your shoulder. But I promise you I'm going to look through your body and see what feels key to me. And I'm going to treat it, whether you're even aware of it, or you can tell me about it, or whether any studies show anything. I'm going to palpate that. How can I palpate that? This is my specialty. Cardiologist listens, they hear all of these vast things. A non-trained person listens, boom, 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 boom.
So that's it.